Sepsis is a silent killer. Do you know what is? Learn about sepsis and save lives.
Every minute, 30 people in Africa develop sepsis and 6 people die because of sepsis. Sepsis is an emergency. Sepsis is the final common pathway to death from the vast majority of infectious diseases worldwide. It arises when, in combating the infection, the immune system damages a person's own tissues and organs. This can lead to organ failure and ultimately death. Most infections can lead to sepsis, including viral infections. Among them are common infections such as pneumonia, tuberculosis, urinary infections, infections in the abdomen, skin or wound infections, or meningitis. Seasonal flu, COVID-19, malaria, dengue, and yellow fever and Ebola may all result in sepsis. More than 80% of infections leading to sepsis are contracted outside of a hospital. Anyone can get sepsis. People with a weakened immune system are especially at risk. This includes young children under 1, pregnant women, people with chronic disease of the lung, liver, or heart, people with diabetes or HIV, and adults over the age of 60. But sepsis can be prevented. The easiest way to prevent sepsis is preventing infection in the first place, which can be done through vaccinations, such as COVID vaccination and basic hygiene. If an infection has led to sepsis, it must be recognized quickly and the source of the infection treated with antibiotics. Early treatment of infections and early recognition of sepsis saves lives. Sepsis can be detected by symptoms like slurred speech, confusion or drowsiness, extreme shivering, muscle pain, fever, passing no urine all day, severe breathlessness, feeling like you're going to die, skin mottled or discolored, not being able to stand and walk unaided is also a bad sign. Sepsis is the most preventable cause of death worldwide and in Africa. It affects 13 million people a year in Africa and at least 3.5 million die. Many survivors face long-term consequences such as poor memory and concentration and loss of income due to being unable to work. It can be prevented by vaccination, sanitation measures such as access to clean healthcare facilities and clean water, clean delivery, and above all, awareness. You can help end the sepsis crisis. Tell your loved ones. Share this video and donate to support the African Sepsis Alliance in raising awareness, prevention, and research. While you were watching this video, about 20 people died of sepsis in Africa. Sepsis is an emergency. The more people know about sepsis, the more lives we can save. Stop sepsis. Save lives.
Hello, everybody. Welcome and thank you all for joining this webinar today. My name is Emmanuel Nsutebu. I'm an infectious disease consultant currently working at Sheikh Shakbut Medical City in Abu Dhabi, and I'm the president of the African Sepsis Alliance. It gives me immense pleasure to welcome all our panelists today, as well as all the participants on this webinar. World Sepsis Day, the 13th of September, is a day created by the Global Sepsis Alliance when we take stock and assess and celebrate all the activities going on across the world to reduce deaths and suffering as a result of sepsis. It's also a day when we look forward and assess what we need to do to continuously and further reduce the burden of disease related to sepsis, mortality, and morbidity. And it's for that reason that the African Sepsis Alliance has organized this webinar today entitled Tackling Sepsis in Africa, the Neglected and Silent Killer. We have assembled leaders from across the continent as well as the globe to discuss this important topic. And today we are going to be outlining a path to bring about change in Africa. And through this webinar, we expect to get more commitment to change, to overturn the huge burden related to sepsis in Africa, which is causing a significant amount of deaths and suffering, as you've heard in the video played at the beginning of this webinar. In terms of the agenda, I'm going to provide an introduction to start with, to set the scene and highlight the problem. Then we are going to engage each of the panelists, I'll introduce them and ask them a few questions to help really take the objective forward. And then we're going to summarize at the end and close, but also give an opportunity for Dr. Mohammed, who is Vice President of the Sudanese Sepsis Alliance, to also say a word, and I'll explain why that is in a minute. So we expect that it will be approximately 1.5 hours, and I have no doubt that it will be a very informative and enjoyable session. And at the end of it, we'll have some clear route for sepsis improvement in Africa. So with that, what I'll do now is share the screen. We have a chat. You can use the chat to ask questions, and we'll look through the questions during the session. This session is also recorded and will be made available through the African Sepsis Alliance website and YouTube for anybody who may have missed the session. So with that, I will just share my slides and then I'll start. So why should we focus on sepsis in Africa? At the moment, we have got a significant problem with sepsis globally and in Africa, where the burden of disease for sepsis in Africa is highest, whilst the amount of sepsis improvement activities is the least in the world. So we've got a disequilibrium which we need to overturn. And everybody in Africa deserves to survive sepsis, just like in other continents, in Australia, in North America, and also in Europe. This is a map from the Lancet Burden of Disease for Sepsis report, which was published in 2020. And what you see in the center is the African continent with the highest age standardized sepsis incidence per 100,000 population, with some countries having more than 2,500 cases of sepsis per 100,000 population. The African continent is the center, the highest continent of the highest burden in terms of incidence of sepsis, and also other continents like Asia and Latin America. If you look at deaths, unfortunately, it's the same picture, with the African continent in the center having the highest number of incidence of deaths per 100,000 population. Each year, it's estimated that there are approximately 49 million cases of sepsis globally, with resulting in about 11 million deaths. In the African continent, there's 17 million cases of sepsis each year. That's about 35% of cases globally. So it's a continent with the highest number of cases. And in terms of deaths, 3.5 million deaths. Again, about a third of deaths globally in the African continent. So by far, highest burden of disease in terms of numbers of cases as well as deaths. And to bring it home, the estimate is that every minute about 30 people develop sepsis in Africa and 6 people die as a result of sepsis in Africa. It's really significant numbers. In Africa, it also affects younger population, and I'll come to that in a minute. So there's a disproportionate number of years of life lost from the African continent because of sepsis. Put it in another way, looking at the case fatality for sepsis, the 30-day mortality for sepsis in Africa is estimated to be about 50%. So half of patients who are admitted to hospitals in Africa with sepsis will die within 30 days of admission. In other continents, it's estimated to be 20 to 30%. So disproportionate fatality related to sepsis in our continent. In Africa as well, the population that are most affected are first children, neonates. So it's estimated that globally, there are around 300,000 deaths every year as a result of sepsis amongst neonates, newly born. The large majority are in low and middle income countries. Apologies about that, about the technical problem. I'm going to just continue from here. We talked about the case fatality related to sepsis in Africa, with around over 50% of patients admitted with sepsis to hospitals in Africa dying within 30 days, compared to approximately 20 to 30% in other continents. We also highlighted the fact that in the African continent and other low middle income countries, the population, groups of people affected by sepsis is also different. Globally, it's estimated there are around 300,000 newborns that die as a result of sepsis globally. The large majority are in low and middle income countries and the African continent. In terms of pregnant women, globally, around 130,000 deaths related to sepsis, maternal sepsis. Over 99% of these are also in low and middle income countries globally, and African continent specifically. And in terms of adults, it tends to be younger adults that are affected compared to the elderly and people with other comorbidity in other continents in Europe and North America. So it does result in a significant amount of years lost and economic impact. In terms of the sepsis in the African continent is quite different from sepsis in other parts of the world. The host is different. It tends to affect people who are malnourished, may have HIV, higher rates of HIV, and young adults and pregnant women, as I've mentioned, and neonates. The pathogens that cause sepsis in Africa are also different, and different studies have highlighted sepsis, tuberculosis, for example, being a significant cause of sepsis in parts of Africa where HIV prevalence is high, in Eastern Africa and also South Africa. And there are also higher incidence of zoonosis, infections that are passed on from animals to man, as well as higher rates of antimicrobial resistance. In addition to that, our healthcare systems are weaker, limited resources, there's less access to critical care services to support patients that are severely ill, such as with sepsis. Health-seeking behaviors also tend to be different, with people presenting quite late to hospitals with sepsis. And we have limited data about sepsis in Africa. In fact, the estimates of sepsis in Africa are from other continents extrapolated to the African continent, rather than core data coming out of Africa. And we also know that some of the interventions that are used in other parts of the world to treat patients with sepsis and save lives may not necessarily be also beneficial in the African continent. There have been studies that have shown that, for example, resuscitating patients, adults, and also children with large amount of fluid in Africa with sepsis, patients with sepsis may also worsen outcomes, whilst it may not do the same in other continents. So we can't transpose strategies from the West to Africa, and research is needed to identify the optimal management strategies for Africa. So sepsis in Africa is different from other continents. The work of the African Sepsis Alliance and our mission really is to provide leadership to reduce the mortality and suffering from sepsis in Africa. And we've been doing that since 2016 through a number of different interventions: advocacy, education, research, and also quality improvement and strengthening healthcare services. In 2017, the World Health Assembly Resolution 70.7 was passed on sepsis, committing to significant change globally for prevention, recognition, and management of sepsis, and also committing nations to invest resources in sepsis improvement. Unfortunately, despite the resolution 2017, there's been little traction and change in the African continent. At the moment, the African Sepsis Alliance has over 15 countries as part of the alliance. Sudan was our strongest country in the alliance, with a very strong sepsis alliance, with national conferences linked to the Ministry of Health, their work linked to the Ministry of Health, also with the Medical Students Association and Sepsis Alliance, involving patients in their sepsis improvement program. However, this has been completely devastated by the war, and it's very sad to say that our flag bearer sepsis improvement, which was Sudan, that light has been dimmed really, and we're hoping that Mohammed will give us a feel of what's happening in Sudan at the moment and give us some hope. But war really has turned down that light in Sudan. When we talk about sepsis improvement in Africa, we have to really try and figure out where it fits, because there are a lot of different things that are being done that are related to sepsis. The core of sepsis improvement is recognizing and treating patients with sepsis, early recognition and treating patients with sepsis. So it's about strengthening health systems to recognize and treat severely ill patients, sepsis being one of the groups of severely ill patients. And it's about it's also linked to improvement of recognition and response to emerging infections such as COVID-19 and Ebola. There is also increasing recognition that after discharge from hospital, the morbidity and mortality related to sepsis continues, and that's been described in the West and also described in children and adults in Africa. And so we have to also pay attention to post-discharge care and follow-up for patients with sepsis, and intervention that can reduce mortality even after discharge. But sepsis starts from infection, and so anything we can do to prevent infection will also reduce the burden of sepsis. And so vaccination, improving access to vaccination and uptake of vaccination, reducing the impact of antimicrobial resistance and effectiveness of antibiotics with stewardship, as well as infection prevention control and improving access to water and sanitation and patient safety interventions in healthcare facilities. All these are also linked to sepsis improvement, and a plan for sepsis improvement has to encompass all these aspects. In terms of the different shields for improvement of sepsis, within the African Sepsis Alliance, we picture it in this format. There's work that needs to be done on advocacy, education and training, both for members of the public as well as healthcare workers. We also need to improve quality of care and strengthen health systems to identify and rapidly treat patients with sepsis. But there's also data that needs to be generated, describing the burden of disease for sepsis, for example, but also looking at prognostic markers, etc. And we also need research and evidence from Africa about interventions that are likely to make a difference from a public health point of view, as well as from an individual clinical point of view. And we need to also focus on high-risk groups, as I've mentioned, young adults, neonates, and pregnant women. Now, the good news is that there's been success in other countries and continents. And these are examples. In Australia, Sweden, UK and Republic of Ireland, within Europe, in North America, USA, New York State, and Canada, British Columbia. These are all examples of regions and countries where there have been action plans, widespread large quality improvement projects that have demonstrated significant reduction in morbidity and mortality related to sepsis. Australia is a very good example with a national action plan and quality improvement projects at national level that has described and seen a reduction in mortality. Now, in the African continent, despite the large burden of disease, we have not yet seen any of these, and that lies the problem. So our current challenge is the acknowledgement that we have a big problem in the African continent, but we have not seen any large-scale improvement activities across Africa. We also have a lack of commitment at the moment for improvement, which is why we're doing this webinar, to help bring about change. We have regional institutions that are not yet heavily involved in sepsis improvement that we need to overturn, and it's not yet prioritized by policymakers, despite all the data which I've just highlighted. And so we don't have any government or ministry of health within the African continent that is demonstrating improvement with an action plan as well as large-scale quality improvement program. We also don't have high-profile members of the public involved in sepsis across the African continent, and we have limited data from Africa about burden of disease and research. So these are all the challenges. And so in summary, in Africa, we have high burden of disease for sepsis, high number of cases and mortality. We have limited action from African institutions. There's an urgent and need for collective action to overturn and reverse this. And this needs commitment, which at the moment is lacking. And we need this to also come from African institutions who should really be leading this process. And so that brings us to the ultimate question for this webinar and panel discussion, which is how do we change the imbalance that we have at the moment between high burden of disease for sepsis, but very little sepsis improvement activities. And everybody in Africa deserves to survive sepsis, and we have to find a way to do that. As sepsis improvement and sepsis experts, we are all tired and frustrated of going to conferences, going to meetings and hearing about the burden of disease for sepsis being highest in Africa, and at the same time hearing about all the improvement activities in other parts of the world, demonstrating lives being saved, demonstrating reduction in morbidity, but not hearing it from Africa. And that's really why we're here today. So we're hoping that we're going to get from our panelists some really useful insights about what we need to do and some commitment about what we're going to do to bring about the change that's required. So with that introduction, we're going to start the panel discussion now. We've got a great panel of leaders from the African continent as well as the globe, and they've given up their time to provide their expertise and hopefully also their support to bring about the change which is greatly needed in the African continent to save lives of our brothers, our sisters, our parents, our children in Africa. But with that, I'm going to start by introducing our first panel member. And rather than starting out and zooming into Africa, I think we're going to do it the other way around. We're going to start from the African continent, experts in the African continent, and then zoom out to our experts that are from the globe. So I have the pleasure of introducing our first panelist and expert. That's Dr. Tajudeen Raji, and he is head of division of Public Health Institutes and Research for Africa CDC and African Union. He also is responsible for National Public Health Institutes and also Health Workforce Development and Public Health Research at Africa CDC. And so, Dr. Taj, let me start by asking you, why do you think the African continent is not leading global sepsis improvement efforts at the moment, despite having the highest burden of disease?
Thank you, Emmanuel. First and foremost, I bring you all greetings from the Africa CDC. I want to say good morning, good afternoon, good evening, wherever you may be joining from. And let me also seize this opportunity to congratulate the African Sepsis Alliance. And I think Emmanuel, we've known each other now for close to a year, but you've done a lot of advocacy as far as control of sepsis on the continent of Africa is concerned. I think from your presentation, it's obvious why we're not making progress. Perhaps I may just want to complement what you have already stated. First, let's look at the sort of financing mechanism that we have for our health system as far as the continent is concerned. I'm sure we are all aware of the Abuja Declaration, which clearly mandated each and every member state. Talking of members, we're talking of the 55 African Union member states to allocate 15% of their GDP, on health. Today, we are far from that. I think we have only 2 countries or so who have actually, been able to do that. So that's number one. Number two, when you also look at our health system, I think is far from being modern. Most of them are quite old. The infrastructures are not there. Even what it takes to diagnose some of these, infections are also not there. Take for instance, vaccination. We know that it takes on the average 10 years between when a vaccine is introduced in the global north and that same vaccine gets to the global south, So what happened in that, that 10 years interval? So again, there's also one big issue. Then we also have the problem of so many silos, so many vertical programs that do not speak to, one another. Today you have, the Africa Sepsis Alliance. I don't know whether we have the African Academy of Sciences on this platform. I also don't know whether we have the academic institutions, as well on this platform. So again, I think that lack of coordination, lack of collaboration, lack of communication, lack of cooperation, between the key stakeholders as far as that space is concerned is also a very big issue. I'm happy that as part of your suggestion on what do we need to do differently, to get, the desired impact as far as our sepsis is concerned, the need to work with the African institutions, again, thanks for your leadership, Emmanuel. African Union has been there for close to, how many years now? Since 1963. I'm not sure there has been a structured and deliberate attempt, to engage African Union to really support this agenda, to leverage that political platform, to leverage the advocacy platform, the convening power of African Union. I'm not sure we have been able to do that. So really happy to see my brother from Africa Development Bank on this panel as well. So really, I think it's high time we begin to leverage on the different sort of platforms we have on the continent of Africa, meaning the Africa CDC, the Africa Development Bank, the Africa Continental Free Trade Area. I think these are all assets, that would need to begin, to leverage to be able to move this agenda forward. So really, not until we are able to really, leverage on these assets, unless the different public and the clinical assets on the continent of Africa, I don't think we'll be able to move forward. Last but not the least, one critical issue here is we also do not have a structured platform that allow colleagues within the public health ecosystem, to discuss and coordinate with colleagues within the clinical, space. That platform is not there. So really, I think it's high time we begin to really come up with what we think will work, a sort of, mechanism that will allow the public health colleagues and the clinical colleagues to be able to work together, to address some of these pressing issues, especially the aspect of sepsis. So let me stop here, and when I have opportunity to come back, I will share with you what we are doing as Africa CDC to address, sepsis as far as the content is concerned. Thank you, and over to you, Chair.
Thank you very much, Dr. Tajudeen. That's a really useful explanation of the reasons why we haven't had traction, but also of opportunities. And we'll come back to the African CDC and African Union and what can be done. And as you said, I'm sure you've given some thought into what we can do practically to take this forward. You segued quite nicely by mentioning that we have a representative of the African Development Bank here. And so it's with a lot of pleasure that I'll introduce our next panelist, Dr. Babatunde Omilola, who is Head of Public Health Security and Social Protection at the African Development Bank. And he's also he's also lead for the Human Development Division, and has experience also of coordinating a task force for implementation and monitoring the achievement of the Sustainable Development Goals. So with that, I would like to ask Dr. Babatunde, in your role within the African Development Bank, how do you think the African Development Bank and maybe other institutions can support sepsis improvement and drive the changes which are required?
Thank you very much, Emmanuel, and good evening to you, to colleagues, and all the other panelists. To handle another urgent assignment for the bank. So I am joining you from Congo, Brazzaville, where
there might be a slight problem with the connection.
On partnership on how we work together. And so many of these issues, including we deal with African sepsis issue, also came up in our conversation. Now, I think from the African Development Bank point of view, we have been responding a lot, in particular, when the Ebola crisis occurred, we responded adequately to it by supporting the Ebola-affected countries with more than $225 million to respond. With the COVID-19 pandemic, our board approved a $10 billion COVID-19 crisis response facility to stabilize African economies, but also to provide liquidity for African governments. A significant grant, our institutions, including the Africa CDC, the through the West African Health Organization, but also to the World Health Organization regional to support our regional economic communities. In doing all of these, that for us to be effective in how we respond to any kind of health system coherent strategy on how to approach health in Africa. And so the very first time in the year of the bank, we have a strategy which we call the Strategy for Quality Health Infrastructure in Africa. And it is through this strategy for quality health infrastructure in Africa that we can provide on dealing with sepsis and many other diseases that affect African countries. So for this particular strategy, our approach is to go through the primary health care infrastructure, but also in terms of diagnostics infrastructure, and then deal with other issues, including digital health, innovations in health service delivery, as well as providing guidance of harmonization of health policies, regulations, and standards in different African countries. So those are the ways that we think we can approach or tackle any kind of diseases or any kind of health shocks in Africa, including, of course, sepsis. So for us to really approach, approved a limit of up to $3 billion for us to deal with health infrastructure in Africa. A pharmaceutical action plan through which we are going to be supporting local production of vaccines, of pharmaceutical and medical products in Africa. So these also, our borders approved for us and all between now and 20.
I think there might be a connectivity issue again there. Dr. Babatunde, are you back? I think they may have frozen, but I think we've got the main gist of the message from Dr. Babatunde, that there are a number of programs within the African Development Bank focusing on health infrastructure, primary care, for example, as well as diagnostics and pharmaceuticals, that we may be able to link sepsis improvement to and get some traction. Whilst we're waiting for Dr. Babatunde to come back, and I'm sure we will get some more practical steps from Dr. Babatunde linked to the African Development Bank, we will just move to our next panelists and also ask some questions. So our next panelist, also a leader, an expert from Africa, is Dr. Pierre Kariyo, who is a medical officer, works at WHO Afro, and he is in charge of healthcare services, service delivery systems, quality of care, as well as safety and infection prevention control in WHO Afro. And he's a pediatrician by background, and previously also was, I think, dean in medical school, dean of medical school in Burundi. So with that, I will pass the floor to Dr. Kariyo and ask him what, according to him, is the role of WHO Afro in sepsis improvement, and perhaps also how the WHO Afro can help accelerate the change that is needed in Africa.
Thank you, Emmanuel. Can you hear me?
You loud and clear. Thank you.
Yeah, thank you. First of all, let me come in by saying that WHO has passed a resolution in 2017, which is called Accelerate and Improve Prevention, Diagnosis, and Clinical Management of Sepsis through Technical and Financial Support. So this is officially the umbrella under which actions are being implemented since that time. So that resolution, which is from the World Health Assembly, was mainly focusing on 4 items. Number 1, to develop WHO guidance on sepsis prevention and management, to draw attention to public health impacts of sepsis and estimate the global burden of sepsis, to support member states to define and implement standards and establish guidelines, infrastructure, laboratory capacity, strategies, and tools for identifying and reducing incidence, morbidity, and mortality due to sepsis. And lastly, to collaborate with other UN organizations, partners, international organizations, and stakeholders to enhance capacity to diagnose and to treat patients with sepsis. This is highlighting that what Emmanuel draws as the bad picture of Africa with limited data with the high burden. So we are really very aware of that. And in Afro, actions are being taken, I would say, in three directions. Number one is to accelerate AMR and IPC. So this is done in conjunction with accelerating efforts to vaccinations, particularly to tackle the issue of under 5 fragile children and neonatal sepsis, which is a high burden. Secondly, we have been putting efforts on strengthening patient safety through the health systems. Yes, we recognize that our health systems are weaker than the other parts of the world, meaning Europe and North America. But efforts have been put in place really to improve our health systems to be able to improve quality of care and particularly address issues of sepsis. So when it comes to what is being implemented now in Africa, I would say that what we are now doing is particularly to have actions that help each country to develop and continue efforts to reduce AMR and promote appropriate use of antimicrobials. This means if like we can see in the data published recently by your institution, meaning African Alliance for Sepsis, it is shown that there is a high burden of pathogens that are very resistant, particularly gram-negative and positive gram that needs to be tackled through strong partnerships and through antimicrobial stewardships. Secondly, we are implementing standard and optimal care and strengthen medical countermeasures for diagnosing and managing sepsis in countries through support to national medical associations. The third thing is to increase public awareness of the risk of progression to sepsis from infectious disease through health education, including, like I said, patient safety, in order to ensure prompt initial contact between affected persons and the healthcare system. And lastly, we are putting an emphasis to develop training for all health professionals on infection prevention and patient safety, and on the importance of recognizing early sepsis as a preventable and time-critical condition with urgent therapeutic need, particularly access to antibiotics in the first hour of the diagnosis. This is to mention just a few. I can come back again and answer to any questions that may arise. Thank you, Mr. Chair. Over to you.
Thank you. Thank you, Dr. Kariyo. Really useful description of the work of WHO Afro and linked to the diagram or the chart which I showed about prevention of infection and infection prevention control, water sanitation, vaccination, stewardship, resistance. And I guess when Dr. Wallis also intervenes, I think you also highlight what's being done in WHO HQ headquarters, which will also come back to what the WHO Afro can do in addition to what they've done already. So thank you very much for that comprehensive response. I'm going to ask next question to our next expert and leader from Africa. And this is, I have the pleasure of introducing Dr. Mamdouh El Arraby. who is a vice chair of the El Arraby Hospital in Egypt. And it's one of the largest and modern hospitals in the Middle East and North Africa region. And he's also a significant member of the El Arraby group that is involved in a lot of business as well as philanthropic work across Africa. And so the question for Dr. Mamdouh is, can you tell us a bit more about what El Arraby Hospital is doing in terms of sepsis improvement, and also what is the potential for your organization, the hospital, as well as the group to support and drive the improvement which is needed in Africa?
At first, I thank you, everybody, to be with you. Thank you for introduction. It is our pleasure to be in this webinar. Thank you very much for everything. Now, El Arraby Group started for medical field since 1985. The hospital in Monofia is started in 2017. We start by accreditation from GCI accreditation, international accreditation. We found in a rural area, there's a lot of cases of sepsis. We start to treat like every hospital in intensive care, in inpatient, outpatient. But we start after this how to prevent as much as we can with other medical facility in the area. Also make a training for doctors and healthcare providers in the area for prevent or decrease the level of epidemiology of sepsis. We started to make awareness for the patients and every people in this area how to define with us early diagnosis of any focus for septic focus. So we after this we decrease the epidemiology. May I introduce Professor Dr. Maha Itouni. She is a professor of medicine in Ain Shams University. Also, she has good experience for many years in infection control and also sepsis prevention. May I introduce her to
I think because of connectivity, Dr. Mamdouh.
Hello, can you hear me?
We can hear you.
Me?
Yeah, we can hear
yes,
you.
I'm Dr. Maha Itouni, Professor of Internal Medicine, Infection Prevention and Control Specialist, and Preventive Medicine Specialist in Arraby Group and Ministry of Internal Affairs. I'd like to share with you our experience in Al Arraby Hospital regarding combating sepsis and especially antimicrobial resistance, the growing challenge we are facing nowadays. I'm going to just allow me to share.
So, Dr. Maha, it's supposed to be more of a panel discussion rather than a.
Yes.
So, if you don't mind, in terms of interest of time, also, I don't know how many slides you've got. Is it going to be brief?
I can go. I just will show you pictures about our participation in the sepsis prevention and antimicrobial resistance, the strategies we adopted from the known strategies. Just to go on, maybe 10 minutes. Is it okay?
I think 10 minutes, it's a bit long, not what we planned for this session, but perhaps you could just talk us in a few minutes, give us highlights of the key things you're doing. Just give us highlights and just not in 10 minutes, just highlights just in the interest of time.
Just a highlight. Okay, all of us, we know that sepsis, the infection in most cases of sepsis, if it starts in community, it starts before hospital admission in 80% are preventable. So the role of society is to early recognize, seek medical advice, and to promote healthy behavior in the community so they can prevent sepsis. Regarding our role in prevention of sepsis, we have rules in the community. Al-Araby Hospital, one of the Delta biggest hospitals in the Delta regions. We are concerned with helping our community regarding health projects, environmental projects, human resource projects, and service projects. For stopping antimicrobial resistance, we carried out campaigns to combat infection for our visitors and in the village and inside our hospitals, especially regarding hand hygiene and antimicrobial resistance. We made leaflets. We distributed, it was in a sample language. We had activities in the OPD. We have activities in the school, and they either in the school or we invite the school to the hospitals. We have leaflets and Facebook interface. And we have awareness sessions for our community in the factories. We have a success story regarding raising a campaign to prevent sepsis and infection secondary to respiratory infection. We carried workshops. We engaged our community so as we can carry social mobilization. We let our community to change its behavior toward healthy behavior through workshops with volunteers from the community. The volunteers, we generated ideas they can use to promote health behavior, and they choose to do Muppet show and act and songs and coloring book for the children. The coloring book distributed 850 book, and we have 3,000 participants because we allow that child to write who shared with him, and there is a prize for the best coloring book. And there were questions pre and post test regarding their awareness about the problem of respiratory infection and how they can overcome. The evaluation was very good, and we could change more than 80% of our participants from the community awareness about the risk of infection and how to prevent. The other thing we'd like to emphasize that no one size fits all, and we need different communication strategies for different customers. And also, we have some activities implemented in Al-Araby Hospital to prevent the spread of MDRO. We promoted hand hygiene. We have policies and procedures. We have clinical pathways. We track and we have surveillance system for antimicrobial resistance, early recognition. We developed a newsletter for raising the awareness, and letters is updated frequently. These are the newsletter we use. We carried out hand hygiene campaign for healthcare workers, and we display the results of compliance of hand hygiene, and we promote the healthcare worker who have superior performance, and we give them prizes. We have active surveillance system, and this is very important in countries with high prevalence of antimicrobial resistance. We should, in critical area and in high-risk patients, to have active surveillance system. And if the patient have risk, he should be in preemptive isolation pending the results of the active surveillance. And this form we developed, we can use this form with risk factor to identify who are at risk. And then we implement contact precautions, and we implement environmental control measure, and we control our environmental control measure by a checklist. Also, we implement isolation policy, and we control it by isolation bundle follow-up. I think we have to identify, to control the MDRO, we have to identify colonization and infection, carry out early isolation, and intensified measures if contact isolation of infected does not succeed. What does it mean by intensified measures? These measures of active surveillance culture I've just highlighted. Then communicate the rates of infection among your healthcare worker and use bundle approach to prevent infection. This is very quickly highlight of what we did in our community, in our hospital, to prevent spread of sepsis and to prevent spread of MDRO.
Thank you, Dr. Maha, and also thank you to Dr. Mamdouh for giving us a feel of what happens in Arraby Hospital, and you for going in detail. I think to do justice to the presentation you were going to give us, I think we'll have to schedule that for another event, so we can you can share that in a bit more detail, and also there should be more learning. But you've given us a good feel of what's being done in El Arraby Hospital, and we look forward to also hearing from Dr. Mamdouh in terms of what El Arraby Hospital can do and the group can do to support African Sepsis Alliance and the work to improve sepsis in Africa. So thank you again. Now I'm going to then shift tact now and zoom out of the African continent, and we're now going to engage our leaders who are currently based and representing organizations that are out of Africa. And so the first person I want to introduce is Dr. Lee Wallis, who is a lead for emergency care at WHO headquarters. Dr. Wallis was the head of emergency medicine in the Western Cape region of South Africa, and also University of Cape Town, and is now leading emergency care for WHO headquarters. And so, Dr. Lee Wallis, I wonder if you could give us a feel of what WHO HQ can do to help accelerate the sepsis improvement work which is needed in Africa. Thank you.
Thank you, Dr. Emmanuel. Thanks so much for putting this webinar on, and congratulations to everyone involved in the organization of another highly successful and hopefully impactful World Sepsis Day. So a couple of things. The first, I think it's really important that thank you for calling out my prior life, which was 20 years and so just a year ago, because Africa is a very special place in my heart, very place in my work. It's really something that I guess a WHO staff member, but I'm telling you up front before I get into the WHO answer. Emmanuel, you're frozen, so I'm hoping everyone can hear me, because you're the only one with video. So please.
I think it's breaking up a bit. Not sure why.
I'm having all sorts of power cut problems tonight, so please do South African chip. So I'll do. So we have one WHO. We don't really have WHO headquarters and region and countries. While clearly, for instance, here the work of Dr. Pierre and the team in Afro is fundamental to the African response. Anything that we do for sepsis, we do as a joined up organization. So while I'll tell you what we're working on specifically that we're leading from headquarters, it is a one WHO response always. And you've heard quite a lot already this evening about prevention and awareness and communication and antimicrobial resistance and IPC and care quality and the importance of certain population groups like newborns and mothers. I'm not going to go into more detail on that because I think it's been well covered. You raised resolution 70.7 and the challenges around implementation. We hear a lot because any resolution is only as good as its implementation. Now, resolutions all have a sort of shelf life on them. So it's always important to have refreshment of the mandate from the Assembly. And this year we had 3 resolutions about need for better recognition and resuscitation of seriously unwell patients. One was about medical oxygen and the need for oxygen to be available. And I think we can all agree that if we improve the oxygen supply in facilities, we'd be able to provide better care to a lot of our septic patients. But the key one I want to make you aware of is 76.2, which is about integrated emergency, critical and operative care for universal health coverage and protection from health emergencies. Long title, but the bottom line is we have a brand new resolution that has a 6-year life on it that calls for us to do a much better job of integrated approach to the care of the critically ill. And if that's not sepsis patients, I don't really know what else to say. So clearly, I
think you might have frozen in terms of connectivity, and we understand the issues with power cuts, as you said. Dr. Wallis may return, but I think we've it's just the screen may have frozen because of power cuts. I believe Professor Tex Kissoon is on, so perhaps we'll go to Professor Kissoon, Tex Kissoon, and then we'll come back to Dr. Wallis if he managed to reconnect. Professor Tex Kissoon, are you on? I can't see that you're on. Simone, I think you did say he was on, but I can't see that he's on.
Yes, Tex is online. That's what you're told. I'm double checking with him. Give me a second.
He's not coming on the screen that I can see here. If you can signal he's on, then I will introduce him and ask a question. But whilst waiting, Dr. Wallis, I think you're back. Can you? Are you able to speak? And then maybe we can hear you a bit better now without the connectivity problem. I think that is also posing a challenge. So whilst we're waiting, I would like to. Simone, are you about to say something?
Yeah, it seems that Tex says he's online, but I also don't see him amongst the speakers.
Can I ask you to maybe offline speak to him? Maybe he's using the participant link rather than host link, and then we can come back to him. Thank you.
Okay.
Thank you. So whilst we're waiting, I would like to also mention that you will all be aware that there is war in Sudan. And Sudan had our strongest sepsis alliance in Africa. Really active, very passionate people. The Sudanese Sepsis Alliance is led by Dr. Kamal as president and Dr. Mohammed Elfatih, who is vice president and is currently with us on this panel. And these, our colleagues, friends, and brothers and sisters of the Sudanese Sepsis Alliance are simply put, are heroes. They really shone the light for sepsis improvement in Africa, and they were world leaders in sepsis improvement, and actually were given the Global Sepsis Alliance Award for sepsis improvement. And the work that they were doing in Sudan for sepsis improvement was outstanding. And we visited Sudan in 2018, a number of us from the African Sepsis Alliance and the Global Sepsis Alliance, and we were completely fascinated and taken aback by the work that they were doing. Unfortunately, the war has brought devastation as war does. And there's a lot of people from the alliance have had to flee Khartoum and leave Khartoum or leave the country, displaced. And but they haven't given up, and they are still celebrating World Sepsis Day today, and still planning and carrying on with sepsis improvement activities in Sudan. Darkness is, there is darkness, but it's never forever, and the light will shine, and they will come back stronger. And I would like to give the opportunity, whilst we're waiting for Professor Kissoon, to Dr. Mohammed Elfatih, who is Vice President of Sudanese Sepsis Alliance, to say a few words and in recognition of the heroic work they're doing. Over to you, Dr. Mohammed. I think you're on mute. Please unmute, Dr. Mohammed.
Thank you, dear Chairman, Dr. Emmanuel. I'm really appreciating what you said. It's art that's hearing that Sudan will be awarded by the Global Award, which is a healing itself, because our program is all about healing. You know, we're starting like some sort of healing enterprise to raising hope for our people. So we believe that definitely we will revive again as a nation, and to work together to do our best to help our people to make their dream on. As you know, if you want to success any hope, you should dream, because dream is all about life, you feeling living. I just want to again thank you, the African Sepsis Alliance, for this invitation opportunity to make our voice heard and to reflect what's happened in Sudan, which is sadly begins on the 15th of April. It's a warm summer when all of a sudden, you know, a death explosion all around and sound of a gun fire, you know. The people become very fear for what's happening all of a sudden, and they're starting to be terrifying, because this really is a terrifying reality for something all of a sudden, the war. And they keep to flee. They make the decision to flee outside of the capital, Khartoum, because the war is focusing on the capital of Khartoum. And, you know, our people is starting to think, because we know well, the war, it's like the sepsis is affecting the body, the mental, and the emotion. So the idea is come to our minds, why not to make this event like rising sepsis, and at the same time to make a healing framework through this event. And you know, those people now on the ground, they are working in the hospital. They are treating wounded, injured people, and even taking care for women and elderly and children. But in spite of this tireless work, they still want to celebrate the World Sepsis Day. And they make really, I'm really impressed. This is exceptional heroic work, you know, by raising hope among people, by preparing and organizing this event. So what's happened? You know, there is a hidden agenda of war. There is an opportunity behind the war. There's a positive thing, because Sudan, most of the resources is focused on the capital of Khartoum. And because of war, now the resources is distributed for other states. So is something is, I think, positive in spite of this negativity. That's the war let us giving opportunity to empower other areas in Sudan. And you know, for the first time in our history in Sudan, we run not less than, now is 3 events, but with our target is 8 events in 8 states. This is for the first time in our history. And this reflecting the eagerness of the people to move forward and to have these positive thoughts and positive energy, because you know the war have a very negative energy. So they switching this energy to be a positive, so it will not dividing us, but definitely it will strong us and unite us. And thank you again.
Thank you, Mohammed. Really useful and really inspirational. And our thoughts and prayers are with Dr. Kamal, yourself, and the rest of the Sudanese Sepsis Alliance, and all the members that are celebrating World Sepsis Day across Sudan, doing it virtually, and keeping the flame burning. And I'm sure there will be light again. You continue to inspire us, and as I said, you're all heroes. So thank you again.
Thank you.
We are going to return to the input from experts and leaders out of Africa. And so I have the pleasure of introducing Professor Kissoon, who is the president of the Global Sepsis Alliance, who is also heavily involved in, and has always supported the African Sepsis Alliance, supported the creation of the African Sepsis Alliance. Professor Kissoon is a professor of pediatric critical care at British Columbia Children's Hospital and also University of British Columbia, and has been involved in global improvement in pediatric healthcare across the world, and is now the president of the Global Sepsis Alliance. And my question to you, Professor Kissoon, is what in terms of the GSA, the Global Sepsis Alliance strategy for the future, how is that going to support changing the imbalance which we have in terms of the need for more sepsis improvement activity in Africa and low and middle income countries? I think you're on mute, Tex.
Thanks very much. I have a lot of problems getting on and I have to leave. There are so many commitments today. I'm in a meeting in Hamilton. From a personal point of view, I want to reflect first on what I've heard. I am very buoyed by what I've been hearing from the other speakers. And as you've always known, my heart is in Africa. In fact, in a week's time, I'll be going back to Africa to continue our work in Uganda, Rwanda, and Kenya in children. And also, as a matter of from the African Sepsis Alliance, we've been having discussion, Andrew Argent and several of us, on looking at the neonatal and pediatric sepsis issues in Africa, because as you know, the population there is the youngest in the world. From the point of view of the Global Sepsis Alliance, as you know, we are strong advocates for Africa. We've just hired Mariam Yashi as our CEO, and we are going to have discussions with her, robust discussions about how best to support Africa. And because of the imbalance in the world, there are some areas, some alliances don't need much support, some need a lot more. And in fact, during the interview, I stressed that again and again with her. What I think that we need to do is to really create the environment where all these individuals and different organizations within Africa can coordinate and work together. And I think the Global Sepsis Alliance, if we can create an office and a secretariat for the African Sepsis Alliance that can then lead the work of coordination, that would be very, very helpful. And I think that the other good thing is that we have very close links with, I've known Lee from the WHO for decades, both when I did my sabbatical in South Africa, and we've been very good friends. And I know his heart is in Africa also, as he said. So we have a good team. And I know the WHO has really been sort of anxious to get going again, to take guidelines for sepsis and put it in context, which we spoke about before the pandemic, and then we were stymied by the pandemic, etc. So I think from our point of view, you have done a yeoman service in getting the big players in Africa together. The magic for us now is from the GSA, if we can support you in having a regional office and a coordinator. And obviously we'll continue our work with the WHO, with you as lead, because I think it's going to be arrogance for us to take the lead and tell you what to do. That's colonialism all over again. It's the other way around. And I'm glad the way you structured the meeting by giving the voices to Africa first. And as I said, beyond being the president of the GSA, my heart and soul is out there, and I'll be doing the work in pediatrics that is so very much needed. And I'll stop there.
Thank you very much, Professor Kissoon. Really, you made me smile and made my heart beat faster with joy in what you've said. And I think that you've already started answering the question I was going to ask each participant, which is moving into now what we're going to do about it. And you've outlined it really clearly with terms of the GSA and the plans. And I think that is what is really going to help from the GSA and the African Sepsis Alliance to us to move to the next step of thinking about changes. So thank you for outlining that.
Thanks very much. I got to run and give a lecture now. So good luck, and I'll be in touch with you, and we'll keep the discussion going.
Thank you.
Okay. Thanks.
Thank you, thanks. Now we've these webinar and panel discussions going on for around an hour, and we're now going to switch into action mode. And so I'm going to ask the participants one at a time, starting again from our participants from Africa and going out, to tell us in brief what action we can take and what action they commit to taking, them or their organizations, to bring about the change which is needed, that disequilibrium. So now, without outlining the problem any further, what are we going to do about it? And perhaps starting with Dr. Tajudeen, Raji, do you want to first start? What are you outlining or committing for yourself and the African Union and African CDC to do to bring about change?
All right, no, thank you, Emmanuel. A couple of things, but for the sake of time, I will just try to give high-level summary. So, number one, we will continue to support our member state routine immunization agenda. That has started with the COVID-19 support, and will continue to strengthen that even after the COVID-19. And in this regard, we continue to work with Gavi, the Global Alliance for Vaccine and Immunization, who have been in that space. So continue to work with them to support our member states. And as you are all aware, our head of state and government have launched what we call the Partnership for Vaccine Manufacturing, and this is aimed at ensuring that we have equitable access to vaccines generally on the continent of Africa. So we believe that with that, we'll be able to address or prevent infection in the first instance. Number two, infection prevention and control is also one area where we'll continue to support our member states, by way of capacity building, by way of supplies, especially the personal protective equipment, by way of development of guidelines. Number three, the antimicrobial resistance agenda of Africa CDC is something that we'll continue to use to support our member states by way of development of guidelines, by way of capacity building, by way of advocacy, to leverage the necessary political platform to drive this agenda. Number four, on the aspect of diagnostics, because we also need to build our diagnostic capacity if at all we are to address the issue of sepsis. And we have developed what we call the Africa Consultative Forum to Advance Diagnostics, which is also aimed at supporting our member states, as far as the diagnostic space is concerned. Number five, data capacity building, because as rightly mentioned, Emmanuel, we do not know truly what is the burden of sepsis, on the continent of Africa. So we currently have a cooperative agreement with University of Washington, the Institute of Health Metrics and Evaluation. So this is a very good platform that we can leverage to support our members to quantify what exactly is the burden of sepsis on the continent of Africa and be able to come up with policy and practice as appropriate. Then last but not the least, I think primary health care is critical. We need to continue to support our member state, to strengthen their primary healthcare system so that you have a robust system in place that is able to prevent, that is able to identify, and that is able to manage the sepsis when they do occur. And on a final note, Africa CDC will provide that platform that will encourage collaboration, coordination, communication, and cooperation of all the different stakeholders who are actually involved one way or the other as far as this sepsis, control of sepsis agenda is concerned. Thank you, and over to you, Emmanuel.
Thank you. And thank you for outlining that in detail and then finishing with that platform, because as you said, coordination is something we need to do better. And the African CDC and African Union can provide that for us to be able to do that. And if we can do that and also get to a state where sepsis is declared as a priority for the continent, as well as set the framework for action plans within different countries, I think it would help accelerate the changes which is required and linked to the different programs which you've mentioned. So thank you again, really clear plan, and we'll certainly take this forward after the webinar. So I'll ask the same question to Dr. Babatunde. Do you want to outline in brief what can be done practically by the African Development Bank? Next steps, one or two things that you commit to take things forward. I think we have a connectivity problem with Dr. Babatunde. So perhaps Dr. Let's see, maybe Dr. Mamdouh, is there anything you want to tell us that you may be able to do to help from the Arraby group or from the hospital to help with sepsis improvement in Africa?
We have a center of excellence for training and education in the hospital. So welcome for everybody. We can arrange to come. We have a hotel beside the hospital. We can arrange this training and education course. We will send for you a curriculum, including the accredited hours for training and education. And we have accreditation from American Heart Association and also for our Egyptian authorities. So the candidate will come, will take a certificate for this training. If you wanted to arrange to come, hello? Hello?
If we can hear you.
Any country, we can arrange also to come to you in any facilities. We can do this training and education by the high quality standard one.
Excellent. Thank you.
I'd like to add something, if you please. Dr. Mamdouh, we offer specialized course for infection prevention and control of sepsis. Yes. And we can offer this course for our African sisters and brothers if they are interested. And we can have a workshop with them, whether online or they come to us or we go to them. We can share how they can engage the community. For more than 8 years, we have successful story in community engagement, and how can we carry a change in behavior in the community, within the community, from and within the community itself. So we develop community leaders, and the community leaders lead the change, the required change regarding health, prevention of sepsis, whatever the topic is. We have As I told you, in many fields, we have experience in community engagement, and I think our stories were successful stories, and we can replicate. Thank you.
Thank you, Dr. Mamdouh, and also Dr. Maha. We appreciate your input and giving up your time, and we will reach out to you with the offers which you've provided, and we look forward to actually you being more involved with the work of the African Sepsis Alliance to support all the work that we're doing. I'm sure this is the beginning of a fruitful relationship that we'll have going forward with sepsis improvement in Africa. So thank you.
We can revise also the guidelines. I think you have support of CDC, and here in Egypt, we are members in all the infection control guidelines launched in Egypt, and the prevention of bloodborne infection and prevention of antimicrobial resistance, the National Action Plan. We have a diverse
thank you. So
interest we can share with you.
Thank you. I appreciate that. And as I said, we will reach out to you to take this forward out of this webinar. I appreciate that. In terms of the other participants, I just want to give a chance for Dr. Wallis. I think there was a connectivity issue. Is there anything else you would like to say? And also just to if there's anything you want to say in terms of next steps going forward, and anything you want to say from the WHO. So I think Dr. Wallis may be still having problems with the connectivity, and with that, I think we are going to start rounding up. I would like to extend a great thanks to all our panelists and all the participants at the session today, the panel discussion today. Thank you for giving up your time, really useful insights, and we've also got some next steps which we're going to take to reduce the burden of disease, deaths, and suffering from sepsis in Africa. Thank you also to the Global Sepsis Alliance that helped us organize this, to Simone specifically, Katja and Marvin, who's helped with the logistics of organizing this. Also, thank you to my colleagues in the African Sepsis Alliance, including Dr. Mohammed, who is here, and other members of the executive who are not here but may be listening and also help to shape this panel discussion. And I would like to also say we will be playing the African Sepsis Alliance video on sepsis at the end. It's available via our website and also on YouTube, so please do download it and share it across your networks. Available to download for free on our website, www.africansepsisalliance.org. And with that, I'm going to say Happy World Sepsis Day. But before I go, I see that Dr. Abdul Mukhtar has joined. Dr. Abdul, are you able to speak? Are you able to unmute yourself, Dr. Abdul? So just checking that you can unmute yourself before I introduce you. Dr. Abdul is the Director of Industrial and Trade Development at the African Development Bank. And we've had previous meetings with the African Development Bank. Dr. Abdul was involved, and we're now waiting for feedback from African Development Bank on a way forward to take forward some of the things we agreed in our meeting. But perhaps there's a connectivity issue as well, and he can't unmute. Dr. Abdul? I think there is. And so with that, I'll thank all the participants again, thank all the panelists, and happy World Sepsis Day. And hope this inspires all of you listening here to continue doing the work that you're doing in Africa and across the world to save lives and reduce the suffering from sepsis. We are progressing. It's maybe frustrating that we're not progressing as fast as we should, but with this panel discussion, I think we have got a plan of how we coordinate and bring together all our efforts to overturn the disequilibrium and lead to fast sepsis improvement in Africa and save lives. So with that, we're going to play the video, and that will be the end of the session. And this is recorded, so we're going to play it leave it on our website for people who could not join today. Once more, thank you, and over to you, Simone, with the video.
Sepsis is a silent killer. Do you know what is? Learn about sepsis and save lives.
Every minute, 30 people in Africa develop sepsis and 6 people die because of sepsis. Sepsis is an emergency. Sepsis is the final common pathway to death from the vast majority of infectious diseases worldwide. It arises when, in combating the infection, the immune system damages a person's own tissues and organs. This can lead to organ failure and ultimately death. Most infections can lead to sepsis, including viral infections. Among them are common infections such as pneumonia, tuberculosis, urinary infections, infections in the abdomen, skin or wound infections, or meningitis. Seasonal flu, COVID-19, malaria, dengue, and yellow fever and Ebola may all result in sepsis. More than 80% of infections leading to sepsis are contracted outside of a hospital. Anyone can get sepsis. People with a weakened immune system are especially at risk. This includes young children under 1, pregnant women, people with chronic disease of the lung, liver, or heart, people with diabetes or HIV, and adults over the age of 60. But sepsis can be prevented. The easiest way to prevent sepsis is preventing infection in the first place, which can be done through vaccinations, such as COVID vaccination and basic hygiene. If an infection has led to sepsis, it must be recognized quickly and the source of the infection treated with antibiotics. Early treatment of infections and early recognition of sepsis saves lives. Sepsis can be detected by symptoms like slurred speech, confusion or drowsiness, extreme shivering, muscle pain, fever, passing no urine all day, severe breathlessness, feeling like you're going to die, skin mottled or discolored, not being able to stand and walk unaided is also a bad sign. Sepsis is the most preventable cause of death worldwide and in Africa. It affects 13 million people a year in Africa, and at least 3.5 million die. Many survivors face long-term consequences such as poor memory and concentration and loss of income due to being unable to work. It can be prevented by vaccination, sanitation measures such as access to clean healthcare facilities and clean water, clean delivery, and above all, awareness. You can help end the sepsis crisis. Tell your loved ones. Share this video and donate to support the African Sepsis Alliance in raising awareness, prevention, and research. While you were watching this video, about 20 people died of sepsis in Africa. Sepsis is an emergency. The more people know about sepsis, the more lives we can save. Stop sepsis. Save lives.